Meet Dr. Jim Brown, a general dentist. When Dr. Brown started his dental practice, he was asked to sign a dental office lease by his landlord. The dental office lease is one of the most expensive contracts you will ever sign in your career, carefully engineered by landlords to maximize the value of their properties by giving them control over your premises, putting you and your practice at risk. Sadly, Dr. Brown made the same mistake that thousands of dentists make every day. He signed off on a 10-year lease as is, without any idea as to how the details within it will impact his practice in the years to come. This is Dr. Brown's story. 3 years later, the landlord moves another dentist in next door. Dr. Brown tries to appeal to the landlord, but is quickly silenced as his office lease contains no protection language that prevents the landlord from moving competitors into the building. Over time, Dr. Brown suffers a decline in production and new patient traffic declines. 5 years later, the tenant adjacent to Dr. Brown needs more space and decides to take over Dr. Brown's office to expand. The landlord uses his relocation rights in the lease to force Dr. Brown to relocate to Suite B3, a smaller unit on the lower level with no windows. All relocation expenses are Dr. Brown's responsibility, including the complete office build-out from scratch. The doctor reviews his lease, horrified to learn that he's trapped with nowhere to go but Suite B3, as per the relocation clause. 10 years later, the doctor gets notice that he's missed the lease expiry date and must A. renew the lease with a 40% rental increase, or B. vacate the premises and move his office elsewhere in 30 days. Panicked, the doctor renews the lease at the substantially higher rent for another 10 years, paying $25,000 extra in rent per year. With 2 years left on his lease term, the doctor plans to transition and retire from a long, tough career. He finds a buyer and they agree to the terms of the deal, which is $700,000. Unfortunately, at the 11th hour of the sale, Dr. Brown suffers a terrifying awakening when he discovers that 50% of the practice sale proceeds go to the landlord, as outlined in the assignment clause in the lease, a $350,000 mistake that over 50% of dentists today have in their leases. Exhausted and defeated, Dr. Brown exits his practice of almost 20 years, leaving a lot of value on the table, with a less than comfortable retirement savings plan. These are just some of the expensive yet preventable challenges that dentists face every day. The remedy? Know what's in your lease and have it professionally reviewed for risks before you sign or you renew it. Cirrus Consulting Group is dedicated to protecting dentists from these and other traps hiding in your dental office lease. Whether you're starting or buying a practice, renewing your lease in the next 24 months, relocating, expanding, retiring, or transitioning, we can help. Schedule your complimentary lease consultation today.